Hello, welcome back to Dr. Hayatu's medical session. Today, we'll be discussing an important topic: cervical cancer. Cervical cancer is a type of cancer that occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. It usually develops slowly over time, starting with abnormal changes in the cells of the cervix called dysplasia, which can progress to cancer if not detected and treated early. The primary cause of cervical cancer is infection with certain types of the human papillomavirus, HPV, which is a sexually transmitted infection. Other factors that can increase the risk of developing cervical cancer include smoking, having multiple sexual partners, early onset of sexual activity, a weakened immune system, and a family history of cervical cancer. Signs and symptoms of cervical cancer may not be noticeable in the early stages. However, as the cancer progresses, symptoms may include abnormal vaginal bleeding, pelvic pain or pain during sexual intercourse, unusual vaginal discharge, pain or discomfort in the lower abdomen or pelvis, painful urination or blood in the urine. The investigation for cervical cancer typically involves several steps to diagnose and determine the extent of the disease. These may include a Pap smear, also known as a Pap test or cervical cytology. This screening test involves collecting cells from the cervix to examine for abnormalities. Abnormal Pap smear results may indicate the presence of precancerous or cancerous cells, leading to further testing. HPV test. This test detects the presence of high-risk types of human papillomavirus in cervical cells. HPV testing is often performed in conjunction with a Pap smear, especially for women over 30 years old, to assess the risk of cervical cancer. Colposcopy. If abnormalities are detected on a Pap smear or HPV test, a colposcopy may be performed. Cervical biopsy. If abnormal areas are identified during colposcopy, a biopsy may be performed to obtain a small sample of tissue for analysis. A biopsy helps confirm the presence of cervical cancer and provides information about its type and severity. Imaging tests. In cases where cervical cancer is suspected, imaging tests such as ultrasound, magnetic resonance imaging, MRI, or computed tomography, CT scans, may be performed to assess the extent of the cancer and determine if it has spread to nearby lymph nodes or other organs. Lymph node. Biopsy. If there is concern that cervical cancer has spread to nearby lymph nodes, a biopsy of the lymph nodes may be performed to confirm the presence of cancer cells. These investigations help healthcare providers diagnose cervical cancer, determine its stage, and plan appropriate treatment. The management of cervical cancer depends on several factors, including the stage of the cancer, the type of cervical cancer, the patient's overall health, and their preferences. Treatment options may include surgery. Surgical procedures may be used to remove the cancerous tissue and nearby lymph nodes. Radiation therapy. Radiation therapy uses high-energy X-rays or other particles to kill cancer cells or shrink tumors. It may be used alone or in combination with surgery. Chemotherapy. Chemotherapy uses drugs to kill cancer cells or stop them from growing. It may be given before surgery, after surgery, or in combination with radiation therapy for advanced cervical cancer. Targeted therapy drugs target specific molecules involved in cancer growth and progression. Immunotherapy. Immunotherapy drugs help the body's immune system recognize and attack cancer cells. The choice of treatment and the combination of therapies depend on individual factors and may require a multidisciplinary approach involving gynecologists, oncologists, radiologists, and other healthcare professionals. Treatment goals may include curing the cancer, controlling its spread, relieving symptoms, and improving quality of life. It's essential for patients to discuss treatment options, potential side effects, and goals of care with their healthcare team to make informed decisions about their treatment plan. If you found this information helpful, subscribe for more health-related content. Thanks for watching.